health promotion, and disease management. When a patient presents with pain and or discomfort, these are the methods you should use. Remember to always get a baseline for the patient, starting your test on the opposite side of the discomfort. Having a control is imperative.
First thing that we will talk about today, as far as with health promotion and disease management, is palpation. This is the first step in determining any tooth sensitivity or any specific area of where to look, and can be used to know the area for any further testing to be done for the patient. Palpation is basically just an examination performed by applying light pressure and feeling with the hands or fingers throughout different surfaces of the body, such as the oral vestibule, floor of the mouth, TMJ area, lymph nodes of the neck, and you can just feel for any swelling or sensitivity, even any masses, pain, tenderness, irregularities around the neck, jawline, lymph nodes. And it can also be used intraorally to check for a specific tooth that is causing any sensitivity or swelling. And like I said, this can then allow you to do further testing to figure out what the specific problem is for the patient. Because sometimes they're hurting generally, and you need to determine what the cause of that pain or tenderness is. Palpation is also considered the gold standard when screening for oral cancer, or just examining for oral cancer, because it is a non-invasive way of feeling for any masses or anything like that. So basically, you want to palpate during an oral examination. Many times I've gone to the dentist, and that's like just the first thing that they do on their examination, just feeling around the jawline, the TMJ area, feeling for any popping or clicking. But you specifically want to palpate if the patient is feeling any pain in the jaw, or if they do know that they have any popping or clicking when opening and closing their mouth. And specifically if they're having any pulpal or periapical problems, or you might see that they could have those, they'll probably just have will be experiencing pain in a particular area, or as I said before, a generalized area throughout the oral cavity. So palpating can just help determine the location of those, and the patient will feel it more when you do palpate, because you're applying actual pressure to that specific area. So you palpate by gently applying pressure to those areas. And as far as for the oral vestibule, it's easier if you do it one way every single time. So if you start in the upper right quadrant, palpate the oral vestibule on both the lingual and buccal sign, just feeling that vestibule with your fingers and applying light pressure, and just go all the way along the maxillary to the other quadrant, feeling for any irregularities, or seeing if the patient has any sensitivity or swelling, and then you can drop down to the lower quadrants and move along that way as well. Now that is for intraorally. Extraorally, you just kind of start on the jawline and the submandibular region, and just kind of feel those lymph nodes, move along up to the TMJ, and then have the patient open and close as you feel and as you palpate, just to see if there are any irregularities, or if you can feel any clicking along that area. Now, for palpating, it is very beneficial because it is non-invasive. You're not using any instruments or tools. You're not having to go and causing the patient extra pain. You're just feeling if they have any sensitivity, and that way you don't have to do their entire oral cavity and search for the sensitivity throughout the whole thing. You can narrow it down because once you use some of the other testing and other examinations, they're going to be in much more pain than when they came in. So it also allows for oral cancer screening, diagnosis of periapical or pulpal issues, TMJ problems, and then, as I said, no need for specific instruments. Now, contraindications, one thing that is kind of, it is subjective because every person has a different amount of pressure that they apply and a different technique that they use, so it's very hard to standardize between individuals, and that can cause maybe the results to vary a little differently depending on the technique, the dominant hand, and different pressures that they may use. Now, one thing out there that is used for palpation is what's called the palpometer. And this is a possible solution which can measure the patient's pain response to a specific amount of pressure. And when in a study, when comparing manual palpation to using the palpometer, the manual palpation was more irregular, and the palpometer was much more reliable and consistent as far as with accuracy in applying the correct amount of pressure. This may be a little difficult to use as far as for the oral vestibule intraorally, but on the outside, it might be a good solution if you're having difficulty using the same amount of pressure throughout. So just like to thank you, and that's palpation, and now we will move on to percussion.
The percussion test, as the name indicates, involves hitting or tapping the patient's teeth with a hard object such as the end of a dental mirror. It can also be performed with the tip of your finger so as to not cause your patient too much pain if they have extremely sensitive teeth. The purpose of this test is to indicate whether there is damage to the periodontal ligaments, which is indicated by the pain. The most common time to perform the percussion test is when we suspect that there is damage to the PDL or the patient has recently experienced trauma. So there are many instances in which a patient would experience trauma, such as in kids, they could be walking around because they're clumsy, they could fall and hit their faces on a coffee table, and their teeth could move because of this. So if a patient came in like that, then you would probably perform a percussion test. I mean, it could also be an adult. These things don't just happen to kids. As stated previously, this test is very easy to perform. You want to start with your finger, as teeth that have undergone trauma can be exquisitively sensitive, and they can have a very, very painful reaction to using the end of the mirror. Pain during tapping by either the finger or the mirror indicates inflammation or damage to the PDL. Another interesting thing that this test can elucidate is ankylosis of the tooth. So, if when you tap with the mirror there is a metallic tap, then that could indicate that the PDL has been resorbed and the tooth is ankylosed. The benefits to this test are that it is quick and non-invasive and requires almost no special equipment. For the best aesthetic and functional results, it is sometimes best to have quick information so you can provide treatment as soon as possible. The biggest contraindication, as we have stated earlier, is that this test can be exquisitively painful for the patient if they have PDL trauma, which can be extremely unfortunate for the patient, but who doesn't go to the dentist and expect to not get hurt?
When a patient presents to your office with pain while chewing, you should consider the possibility of a cracked tooth. A tooth sleuth is an instrument used as a type of bite test that can effectively pinpoint tooth fractures. The tooth sleuth can locate a tooth with a crack that cannot be identified clinically or radiographically. This test should first be performed in a control quadrant as mentioned previously. The tooth sleuth has a wedge that can easily be placed on individual cusps of a tooth. You ask the patient to bite down on the wedge, and if the patient experiences pain upon biting or release, this is indicative of a cracked tooth. With a cracked tooth, the dentinal tubules are compressed, and fluid cannot freely move. However, upon the release of biting pressure, the dentinal tubules are no longer compressed, and fluid can freely move as described by the hydrodynamic theory. This allows the patient to experience pain and explains their presentation to your office. If you do find that your patient has a cracked tooth, your diagnosis would be cracked tooth syndrome, or CTS. In 2012, an analysis was done by Matthew et al. They described the diagnosis of cracked tooth syndrome as being problematic due to the variable symptoms associated with it. Using a tooth sleuth can be an integral tool for early diagnosis and therefore successful restorative management.
What the cold test is used for is to check the liveliness of a tooth and its pulp. When a patient comes in and has some sensitivity to a specific tooth, you may suspect that that tooth's pulp is at risk for a root canal. And a quick and easy way to test this is by using the reliable cold test. Say, for instance, your patient has pain in the upper left quadrant. You're going to want to first get a baseline. So starting in the upper right quadrant, we would place a Q-tip-like appliance with a cold spray, usually ethyl chloride, and allow the patient to get a feel for this cold sensation. The normal sensation of cold should only last around 3 seconds after removing the Q-tip. Once the patient understands what their baseline is, by the time you reach this hurting tooth, there should usually be a change in sensation. If the patient feels the cold lingering longer than 3 seconds, this is an abnormal result. This means the cold is stimulating the nerve longer than normal and therefore indicating the nerve is hyperactive, maybe from something like a cavity. Unfortunately, the end result for this tooth would be a root canal.
The most beneficial thing about the cold test is its reliability. There was a study done back in 2013 that involved 110 participants, with 60 teeth considered to have vital pulps and 50 teeth to have necrotic pulps. When comparing the cold test to a hot test and to an electrical test, the cold test identified 44 out of those 50 necrotic pulps, which was the most efficient analysis for pulp viability.
This is the electric pulp test. It's a diagnostic tool used to establish the health and sensitivity of the dental pulp, and it's performed prior to treatments such as endodontic, restorative, and orthodontic procedures. It can also be used as a follow-up in monitoring the pulp after tooth trauma. How it's used is you'll first inform the patient of what you're about to do, and then you'll go check out this machine from the dispensary. You're going to dry the tooth completely and apply a small dab of conduction paste onto the tooth's facial or lingual surface. Typically we use toothpaste. Then you'll place the lip clip on the buccal mucosa or ask the patient to hold the metal handle to close the electrical circuit. Place the tip of the probe onto the tooth's surface where the toothpaste was placed. And you'll put this at the location of the pulp horns, where the nerve density is highest. So in your anterior teeth, it's the incisal third. Posterior teeth, it's the middle third. Once the electrical circuit is closed, the level of current will gradually automatically increase until the patient detects it. Then you'll record that number shown on the machine there. And you can adjust the speed of the electric current, how fast it increases. So a normal response is the patient will feel, so you should be sure to tell the patient that it's not a painful procedure. You just feel a tingling sensation, and then they'll raise their hand or they'll let go of the metal rod. So the normal response is the short, sharp pain, which will subside when the stimulus is removed. That's normal. A heightened or prolonged response is the lingering sensitivity after the stimulus is removed. If it goes away automatically, it could be reversible pulpitis, but a lingering pain that continues well after the stimulus is removed is indicative of irreversible pulpitis. The patient could also have no response at all. So that means that the nerve supply to the tooth is gone, and that's usually pulpal necrosis. Or that's what the case is, obviously, in previously root canal treated teeth. So, a big thing with the electric pulp test is that there are false positive and false negative responses. The false positive is when the patient responds to the sensitivity, even though that tooth doesn't have any sensory tissue. That could be seen in multi-rooted teeth, for example, that still has residual pulp left in one of the canals. A false negative is when the patient does not respond to the sensitivity test, even though it has a healthy innervated fibers. This happens on teeth that have been recently traumatized, or it can be a heavily restored tooth and have a lot of tertiary or sclerotic dentin present.
Another tool which can be used for health promotion and disease management is the radiograph. A radiograph is a radiopaque image generated by differential absorption of X-ray photons. With the help of these radiographs, one can view teeth and their surrounding structures in order to evaluate abnormalities in oral health, which are not normally detectable by clinical examination. For example, if your patient has pain in the upper left quadrant of their oral cavity, but the oral cavity presents no abnormal superficial signs, a radiograph would be the most optimal method to determine what exactly is causing the pain and to propose an appropriate treatment plan for the problem. Taking radiographs is a non-invasive method of viewing abnormalities, even before they become clinically visible. Furthermore, modern X-ray machines are made to produce low enough radiation that, with proper procedure, even pregnancy is not a contraindication. So as long as the amount of radiographs taken is as low as reasonably achievable, and the radiographs are not being taken to view occult diseases, then the radiographs can be taken in order to provide diagnostic information that was not previously available through examinations or previous health or medical records. Moving on, in order to generate a radiograph with an X-ray machine, simply place an image receptor in the patient's mouth, angle the X-ray tube near the patient's head and toward the image receptor. Then activate the X-ray by pushing a button on the control panel. The next step in treatment planning can be decided from the evaluation of the radiograph. There are various types of X-ray machines with different methods to acquire radiographs. A different machine may be used depending on clinical findings and your suspected diagnosis. For example, if a patient comes in with maxillofacial trauma to the jaw, it would be best viewed with a panoramic radiograph, but an abscessed tooth may be better suited to view with a periapical radiograph. That is all, and thank you very much.